Welcome doctors to my lecture. I hope you are doing well. We are studying pulmonary physiology. Today we will discuss an important topic, that is the lung volumes. Please subscribe to my channel and hit the bell icon. You can also suggest topics for discussion in the comments section. Lungs are the vital organs present in the thoracic cavity. There are 33 incomplete C-shaped hyaline cartilage rings present in trachea. The lung volumes are the volumes of the lung at different stages of breathing. These volumes are measured by a procedure called spirometry. The person inhales and exhales in spirometer and the volumes are calculated by graph made on screen. Respected doctors, please fully concentrate on next slide to grip the concepts firmly. Thank you. Now we will discuss the graphical representation of lung volumes. The amount of air inspired and expired normally during quiet breathing is called tidal volume. Amount of air that can be inspired maximally on forceful inspiration above tidal volume is inspiratory reserve volume. Amount of air that can be exhaled maximally on forceful expiration below tidal volume is expiratory reserve volume. Amount of air remaining in lungs after maximal expiration is reserve volume. The sum of expiratory reserve volume and residual volume is functional residual capacity (FRC). The sum of inspiratory reserve volume, tidal volume and expiratory reserve volume is vital capacity. The sum of vital capacity and residual volume is total lung capacity (TLC). Let's discuss the values of these lung volumes now. Tidal volume is 500 ml. Inspiratory reserve volume is 3000 ml. Expiratory reserve volume is 1200 ml. Residual volume is 1200 ml. Functional residual capacity is calculated by addition of expiratory reserve volume and residual volume. It is 2400 ml. Vital capacity is calculated by addition of inspiratory reserve volume, tidal volume and expiratory reserve volume. It is 4700 ml. Total lung capacity is calculated by addition of vital capacity and residual volume. It is 5900 ml. Now we are discussing an important concept. Please see the spirometry carefully. Forced expiratory volume in 1 second or FEV1 measures the amount of air that a person can exhale during a forced breath in 1 second. Forced vital capacity or FVC measures the maximum amount of air you can forcibly exhale from your lungs after fully inhaling. The ratio of FEV1 to FVC is less than 65% in obstructive lung diseases and the ratio of FEV1 to FVC is normal or increased in restrictive lung diseases. In obstructive lung diseases the ratio of FEV1 to FVC is less than 65%. The reason being this is that FEV1 decreased more as compared to FVC. As a result the percentage is 65%. This is evident from the graph where in diseased state the slope of the graph is decreased more in first second than in restrictive lung diseases. The ratio of FEV1 to FVC is either normal or increased. The reason is that in restrictive lung diseases, FVC decreases more than FEV1. This is evident from the graph. Respected doctors, now it's time to test your knowledge. Question 1 is the volume of air remaining in lungs after normal expiration is. Option A vital capacity, B total lung capacity, C functional residual capacity or D expiratory reserve volume. Let's take help from this graph. After normal expiration, the volume of air in lungs is a combination of expiratory reserve volume and residual volume. This is functional residual capacity. So, the correct answer is option C or functional residual capacity. Coming to question 2, which of the following is true for obstructive lung disease? Option A increase FEV1, B. Increase FVC. C. Ratio of FEV1 to FVC less than 65%, or D. None of these. Have a good reflection. I know you have got it. When you recall the lecture, you will get to know that the correct option is option C, or ratio of FEV1 to FVC less than 65%.